Recording. Yeah. Fab. And if you've got any questions for Aarti, please put them in the chat. So Joe and I are going to keep a lookout for those. And I note from Twitter that you were in Glasgow last week, so I don't know if you're going to cover that in your talk. But anyway, we look forward to hearing from you. Thank you for sparing the time to come, and take it away.
Thank you, Carolyn. And it's just thank you so much for inviting me to come in and talk to you today. And I'm going to try and cover this huge area of planetary health and primary care and talk about why should we care and what can we do. So why should we care? Well, we do care. We all care. Planetary health is the overarching determinant of human health. It's fundamental, it's foundational, it's overarching. It is not peripheral. It is not separate to anything that we're doing. And I think that this diagram is quite helpful in that way. This diagram talks about it as overarching. You know, we as generalists are in an absolutely brilliant position to understand this because we're always talking about holistic health, aren't we? We're always talking about biopsychosocial wider determinants. Well, here are those wider determinants of health. We've got the people, then we've got the local economy, the community, the lifestyle, the built environment. We know all of those things impact on our health. But actually, we need our planet to provide us those fundamental determinants of health: clean air, sources of water, a stable climate, the ability to grow food, you know, and then all of the other things underneath that are influenced by that. So, you know, the WHO, the Lancet's been saying this for over a decade. The WHO says climate change is the single biggest health threat facing humanity. And, you know, basically there is no health without planetary health. It is the most integral thing. But what is the state of humanity and our planetary home? So I'm sorry this diagram is not as clear as I would like it to be, but if any of you haven't heard of Kate Raworth, then she's an economist who has written a book called Donut Economics. But if you don't have time to read that, then just listen to her TED lecture. It's absolutely brilliant. And she's come up with this model in which she talks about everyone having the right to thrive and moving our economies away from being concerned about GDP, completely meaningless thing, to actually having health and well-being at the center of our concerns. And what she talks about is we all want to live above a certain social foundation. So we should all have access to health, education, energy, food, network, social equity, political voice. And actually, we have shortfalls in that area at the moment. Lots of people don't have access to that. But we have to live within our ecological ceiling because the planetary life support systems are being stressed by various different things. So climate change, biodiversity, land conversion, ocean acidification, just to name a few. But if we can live, you know, within that donut, within the social foundation and below the ecological ceiling, well, that's the place where we're going to thrive. I've just realized that my mouse is all over the place. Here we go. Right. Okay. I think we all know this is urgent. This is, you know, our levels of awareness have gone up hugely in the last 5 years. I know 4 or 5 years ago, when I was talking to people about this, they'd kind of just changed the subject. And that's not the case anymore. The WWF did a survey recently, and 80% of the UK population think that this is essential to our health. They see climate as an existential issue. But you know what? We've been talking about this. This is COP26 that I was at last week. That means more than 26 years, actually, of us coming and talking about this, saying this is really important. And emissions have just been going up. We've kind of managed to just about flatten them, and now we need to reduce them. But look at that steepness of the curve that we need to reduce it by. We are not talking about incremental change. Nobody should be under any illusion that the next decade or 2 decades is going to be similar to what we are experiencing today. It will be transformative. The question is, which transformation will it be? Will it be the transformation towards a climate catastrophe because we didn't act, or we didn't act enough? Or will it be a really positive vision of a really wonderful society that we can transform to, that is actually better, it's more livable because we have made the transformation? So incremental change is not what we need now, because transformational change is coming. And everyone's talking now about the decisive decade. The Prince William is talking about the decisive decade, I've noticed. So that's really good. It's what we do in this decade that makes a difference. So many of you will have come across this slide. This is from the CDH in America, and it's linking the impacts of the climate crisis and health. So you've got the central concerns that everybody knows about: the rising temperatures, the extreme weather, the sea levels, the more extreme weather events. But then you've got air pollution. Air pollution is largely caused by the same cause that's causing climate change, which is the burning of fossil fuels. You know, we know that it not just exacerbates so many conditions, it causes conditions, it causes asthma as well. The statistic is now 7 million people in the world dying prematurely because of air pollution every year. 7 million people. In this country, up to 40,000 people dying every year of air pollution. So, you know, that's a huge topic in itself. We're getting lots more vector-borne diseases. The geographical distribution is changing. We're getting increasing allergens. We've got impacts on food, water, and then there's the extreme effects of health. We're going to have to start talking to our patients who have got heart failure, who've got hypertension, about what they do on hot weather days with their blood pressure. You know, these are really important things that are going to be changing. But let's move to the positive vision. So the really great thing, and this is the thing that I've been trying to get across now for a while, is that actually the transition to the climate action that we need, the transition to a just society, allows us to meet the healthcare needs that we've been trying really hard to achieve for a long time. It's completely aligned. So climate action really aligns with improving public health, because what we're talking about, and what Professor Dawn Scott was talking about earlier, we're talking about increasing green spaces to reduce air pollution. That's going to improve our health now. It's going to improve mental health through connectedness, all of those kind of things. We're talking about active travel. We know the huge benefits of physical activity to health. We're thinking about sustainable health diets. Now, it doesn't matter whether you try and reduce the carbon footprint of a diet, or whether you just try and improve the diet so it's the most healthy diet you can have. They're actually exactly the same diet, and that's what Lancet Eat Planet have come up with. And there's another one called the Canadian Food Plate. Connected communities, we know how much through social, those social determinants affect health. Loneliness affects health. Let's create those connected communities. Let's create an integrated health service which is actually supporting people's health needs through person-centered practice. So this is an absolutely exciting vision, but we don't have the time. You know, health inequalities, poverty, all of these things have been affecting people for so many decades, and yet we have to make an urgent transition. So let's put health at absolutely the center of that transition. And we really need to start connecting the dots. You know, we need to start linking up person-centered practice and health inequalities work and workload crisis and social prescribing with planetary health. Okay, what can I do? That was the second part of the question. Well, I would say you can talk. Don't underestimate the benefit of talking. Okay, you can talk, you can do, you can ask, you can connect. So we're going to talk about all of those things in a minute. But I just put this picture. This is the spheres of influence picture. So think about your spheres of influence. Do not underestimate your sphere of influence. You have huge amounts of influence, not just as a citizen, but also as a health professional, and in all of your different roles as an academic, you have huge influence. So this is the spheres of influence of a child. And look, it goes from child to the UN and international bodies. And I don't think we should try and limit our understanding of our influence, because it can be huge. So one of our areas of influence is the fact that 90% of the population come through general practices doors, comes through primary care's doors. And, you know, I can't remember exactly the name of the study. I can get it for you afterwards, but there was a recent study looking across the globe at what was the framing that motivated people most to want action on climate change, and it was health framing. Well, it is a health issue. The climate crisis is a health crisis, and we are trusted people. Nurses and doctors are the most trusted messengers, so we need to start making the message about this clear to the public. And you know, we need to think about how we do this. So at the COP26, people were giving out climate prescriptions, the climate and health crisis. But also, I went to a talk by Al Gore, and I have to say, I've been doing the numbers talk on air pollution and the stats, the figures of how it affects you from pregnancy to old age. But this statistic, this was, this really got me at my heart. So, a baby born in Warsaw today will inhale the equivalent of 1,000 cigarettes in the first year of his or her life from smog and other air pollutants. That's crazy. 20 cigarettes a day, baby, that is so it's just outrageous, really, isn't it? And they do use a lot more coal power in Warsaw, so maybe it's a little bit worse. But Warsaw is by far not one of the worst polluted places in the world. I think it's in the 50s or the 60s, and most of this air pollution is invisible. 90% of the population of the world is breathing toxic air. Okay, what about us as clinicians? So this is an old slide from the Sustainable Development Unit, which has now become Greener NHS. So many of you will know that the NHS has declared that it's going to be a net zero service. It's the first health service to do so. And that was launched a year ago. But I prefer this slide to the sort of circles that they've got in their most recent report, because it's kind of a lot easier to see on this slide that we're different in primary care in terms of where our carbon footprint is. So in secondary care, in the acute sector, it's kind of, yes, acute medical instruments and equipment, energy use is quite big. But for us in primary care, it's our clinical care, it's our prescribing, that's the biggest part of our carbon footprint. And that's actually really quite empowering for us, because it's all the things that we would do, again, just like all the things that we would do to address the climate crisis, are the things that we would do for public health anyway. The things that we do to reduce our clinical footprint are the things that optimize healthcare. So we're talking about, Carolyn mentioned inhalers. I'll talk about that briefly in a second. Reducing antibiotics, thinking about green and social prescribing. What are our alternatives to prescribing? Can we prescribe physical activity? How can we encourage our patients towards better, healthier diets? And actually, that's the largest bit of what we can do. And the waste and the office and the eco communications, yes, we need to think about all of that. We need to think about patient travel. We need to think about our own practice travel. But the biggest impact is actually in our clinical care. Now, this is a slide from my wonderful colleague, Georgie Salmon, who is a GP in the Northeast. And she's very kindly said that I could use it. She generally likes people to watch her video, and I have to say the video is much better, but it's 3 minutes. So I'm just going to try and briefly talk about how does this all come into the consultation. And she talks about a 53-year-old lady, Sally, who's got type 2 diabetes. She doesn't want to increase her meds. So you have a conversation with her about what's preventing her from maybe physical activity, and she says that she's just really busy. She's in an office job, she's got 2 kids, but she's decided that maybe she can walk to school 2 days a week, and she's going to park a little bit earlier. She's going to walk through a green space. That benefit is increased physical activity for her, increased physical activity for her children, increased family time and connectivity to nature, but also reduced exposure to air pollution, because it's much higher in a vehicle than it is if you're walking or cycling. And those benefits also accrue to the community. The fact that she's taking 1 less medicine has huge benefits to the wider planetary health, in terms of reduced use in terms of carbon dioxide, and also waste and ocean acidification. So we can make a difference in every single consultation that we have. And I really like that slide on physical activity that she's got in this, because it just shows how important physical activity is. There's a huge swathe of our population that are really inactive, and actually just getting them up to 10 minutes of physical activity a day could be one of the best things that we do. Oh, no, that's not what I want. Okay. Another thing that I just wanted to mention in terms of clinical healthcare is a framework for trying to understand what it is that we're doing and how this integrates into everything that we do in clinical care. And this is work done by Frances Mortimer from a charity called the Centre of Sustainable Healthcare. And she talks about 4 principles. What are we doing to prevent ill health? How are we empowering our patients and encouraging them to self-care. What about lean service delivery? So we're talking about effective and efficient patient pathways, meeting the needs of patients where they are at, and to those who need it most, and then looking at low carbon alternatives. Okay, so those are things that we can do as clinicians, and there are some really good tools. So there's the Green Impact for Health Audit Toolkit, which has lots and lots of actions, over 100 actions that you can take, both clinical and non-clinical, and you can get rewards for them. I just mentioned the Centre for Sustainable Healthcare. They've got lots of really useful information, lots of fantastic courses as well. The one I've highlighted there is about sustainable quality improvement, which uses those 4 sustainable healthcare principles. And thank you, Carolyn, for the shout out to the Greener Practice website. We're trying to make it a one-stop resource hub for UK primary care professionals, hopefully linking you in with all the resources you might need for knowledge, but also for action and for linking to other people. So that was do. What about ask? I think we need to think about those spheres of our influence, and we need to think about advocacy as health professionals. We have a huge influence. One of the things that's interested me since I've started working 1 day a week for Humber Coast and Vale ICS as their net zero GP lead, and shout out, by the way, to anyone who's in that area. I'm here to help you, particularly with your respiratory healthcare, so get in touch. Is actually there's not that many places where primary care's voice is heard, and we need to be in those rooms. Every single integrated care service has a green plan. Now they have to be writing it. They're writing it at the moment, and those green plans will include things like models of care. So that's all the stuff we should be talking about to get a resource into primary care. So let's all start asking to our actually that says PCNs, it should say ICSs, but it could be PCNs as well. What are our green plans? If we're in medical education, how are we integrating this into the curriculum? How are we integrating planetary health? Well, we're going to talk about this in our workshop, which is starting after this session, and the wonderful Lauren Franklin from Keele, and I think Keele was the top medical school in terms of the planetary health report card, is going to be telling us what she did. So you need to come and listen to Lauren talk. So what are we going to do? We're going to be discussing that in the next workshop. And then research, we really need to be asking, for those of us who are researchers here, how can research be responsive to this transformative world that we are going to be living in? This decade is going to be transformative. Things are going to rapidly evolve. We need rapidly evolving real world, interdisciplinary, interconnected research. And we need to be challenging existing models of research that aren't going to be useful for the world that we're going to be living in. And then the last thing I would say, what can you do? Connect. This is the most joyous thing to do. It's a really, really joyous experience. It has been for me. So this is those of us who are up in Glasgow. And this is Greener Practice Scotland. So Greener Practice started in Sheffield around my kitchen table, and now there are organisations all over the world, and this is the Greener Practice group in Glasgow. And I'm starting to feel like I have this huge UK family. I can just turn up and someone will host me. We were hosted in these wonderful people's houses. So yeah, connect, because you will be up, you will be down. Helen Toohey, who's here, is also based in Keele, has done some really amazing work looking at the grief model and our response to the climate crisis and how we might go round and round that cycle. That's definitely my experience. You go round and round the cycle, and you need people around you to help you get through that and to support you and keep you positive. And I would actually just recommend the book Active Hope, and another book called The Future We Choose. So the book Active Hope is really, really helpful for when you actually engage with the climate crisis, recognize how urgent it is. There's a real risk that you're going to go down and feel pretty bad about it. This book is going to help you realize that what you're doing is you're focusing on the vision ahead. Your hope is invested in the vision, not in the probability of that vision being achieved. And brilliant book by about the future we choose and the options that we have. So I'm going to stop there. I have actually no idea whether I went over time.
That was fantastic and inspiring, Aarti. I know you were almost perfect timing. So any questions? you've
I'll
done
just,
for her.
whilst we're waiting for questions, one thing that I was going to say is that going back to the inhalers thing, if people are thinking about what is what is a large, low-hanging fruit carbon hotspot in general practice where I might want to do some quality improvement work. So inhalers are, I haven't talked about that, but there's a guide that I'm very proud of being part of having published. If you go onto the Greener Practice website, you can look at that guide. It's gone through the NHS England and Improvement Inhalers Working Group. It's been endorsed by Asthma UK and the British Lung Foundation. It's very much focusing on optimising care as the first point. So do have a look at that. It's also going to help you achieve your Impact and Innovation Fund sustainability indicators. So it is probably something that will be helpful, for everyone. Everyone will be a little bit positive about getting involved with that.
Joe, you've got your hand up, and then we've got a question in the chat.
Yeah, I had my hand up, but Aarti just stole my thunder because I was going to ask about inhalers. Just to then change my question and be provocative, if inhalers are such a massive problem, which we're learning that they are, should we not just change them, just stop prescribing those MDIs, give them something else?
Yes, no, this is a really interesting question, and one that has got people quite worried, actually. So the thing is, the focus on inhalers from an environmental point of view has actually allowed us to reconsider the care that we're providing. So back in 2014, Asthma UK, the National Review on Asthma Deaths told us our patients are massively overusing their SABAs, they're not using enough preventers, and then there was a little issue about combination drugs and giving LAMAs on their own, LABAs on their own. The thing is that hasn't changed. So we still have 2/3 of our population who aren't on preventive treatment, basically effective preventive treatment. So really what it's done is helped us sort of say, and because 70% of our inhaler, the inhalers that are used are SABAs, actually if we just optimize control, we'll do that anyway. The other thing is, I think that probably combination MART therapy is going to be the way for a lot of our patients, and most of that is dry powdered inhaler. The third thing is that most patients use a DPI technique with their inhalers anyway. Most people go, don't use a spacer. They're perfect for a DPI. So we don't have to just stop the MDIs and go DPIs. We can do it with our patients. And I have yet to have a conversation with an asthma patient which hasn't been about their control. So the environment hasn't even come into it. It's been focused on their control, and it's just been better for the environment. So there'll be a small percentage of the population who need to still use an MDI. So we can't switch everyone. We've got to do it with the patient. It's got to be shared control. There is a tiny risk that if we do it without them, because inhaler technique is so important, that we will worsen control. So yeah, we have to do it with the patient.
Thanks, Aarti. Christian, you've got a question. Do you want to ask it?
Yeah, I'll put my camera on. Hi, Aarti, that was fantastic. Thank you. I really enjoyed that. What I find locally is that we've got loads of GPs who are really keen and innovative and patient, but I get the block at the policy level and the commissioning level because it might cost a little bit of money in the shorter term. And I wondered if you had any suggestions or approaches that you've used of how best to lobby and get the powerful arguments across to them. Because at the moment, with ICSs coming in and people not knowing what they look like, there's lots of resistance to anything that might cost money or be a change they're not comfortable with.
That's really interesting. Can I ask at which policy level you found resistance?
CCG.
CCG. Okay. Well, they're going anyway. Well, I don't know. Maybe they'll just become the place instead, the place-based bit of the NHS reorganisation. I just don't think people have connected the dots. So the same people who are saying, we don't have the money, will be investing in something that actually improves sustainable healthcare, gets us to net zero, but they haven't put it together. So if you were to talk in terms of prevention, how are we going to prevent ill health? How are we going to save billions of pounds to the NHS by, meeting people's complex care needs, or doing group consultations, or whatever it is, and then bring those sustainable healthcare principles in? I think that really helps people. I don't know that I think one of the problems is that a lot of the leadership the clinical leadership at NHS sort of levels, all governmental, any kind of not even non-clinical leadership actually don't understand the climate and health connection. They haven't got there, and people need carbon literacy training. So there's an element of just people at leadership levels need to understand this before they can actually connect the dots. But I say positive vision, sustainable healthcare principles, and talking in terms that they recognise.
Thank you. I'm going to ask Helen to talk about the grief cycle, Aarti, that you mentioned. Helen, is that really mean? I'm sorry.
It's quite mean. It's fine. So I was part of a group that was a group of people from, it was the RCGP and the RCG psych group that actually formed to start to look at how they could put pressure on sort of NHS procurement and looking at trying to influence procurement of pharmaceuticals that were produced from more environmentally sustainable companies, basically. But out of those discussions, we also wrote a couple of blogs, and one of those was talking about how to talk to people in practice about climate change. And we just used the grief model and developed a sort of a visual, a picture, basically an infographic, about how people move through the cycle of understanding climate change, their feelings about it, and that initial sort of bury your head in the sand kind of response to moving on to considering how they can act and viewing it in a positive way. And I can share the infographic, but it's probably easier to have a look at than describe verbally.
That'd be great if you can share that.
It's the MJ blog, so I can share that.
Yeah, share it in the chat. Yeah, that would be great. And then I suppose I'm just thinking about whether there's a blog here for the SAPC website or, out of today's conference. But anyway, I'll ask you that privately. Well, I've done it now. Okay, I don't think we've got any more questions, and we have come to the end of this session. So I just want to say thank you, Aarti. That was a really inspiring talk. We've now got a 45-minute break, although